We have a couple of more wishes from the wishing tree. And one of them is for someone who should be here today. It's Lorenzo Munar, who is the researcher in EU-OSHA responsible for preparing and managing all of the content of our musculoskeletal disorder campaign for the last 3 years. He has been in charge of it and telling the rest of us all about MSDs. We're all a lot wiser because of the research he has overseen. So, unfortunately, he was supposed to be here for the last 2 days, and guess what? He tested positive for COVID. So I know he's watching us from home because he's staying at home in isolation for reasons of being very careful. So I just want to say to you, Lorenzo, we miss you. And here's a wish from the wishing tree, and it says, get well soon and come back to us. So now I'm delighted to hand over to my fellow countryman, Michael Gillen, who is currently the chairperson of the management board of EU-OSHA. Michael is part of the employers group and has a background in the bio, pharma and chemical sectors. Here to tell us more about our next campaign on digitalisation. Welcome, Michael, the floor is yours.
Thank you very much indeed, Brenda. And I have to tell you, it's a fabulous honour to be here today. I got in late last night, so I only came for the drink like most Irishmen. And it was a really pleasant evening on the 29th floor. And I have to tell you, the feedback I heard from yesterday's presentations was truly exceptional. So well done to everybody. And it was lovely for me to then get the synopsis from the 3 rapporteurs this morning. And you could see there was a real energy in the room. So well done, everybody. This Healthy Workplaces Summit has shown how we have helped lighten the load for workers across Europe. Over the past 2 days, we've exchanged and reflected upon what we've learned during this very successful campaign. One of the truly unique aspects of our Healthy Workplaces campaigns is how we bring diverse groups together. And you saw it in our panel discussion today. It was really diverse. And that's what is needed, because that helps us address these complex challenges. Employers, workers' representatives, policymakers, scientists, researchers, inspectors, EU-OSHA, they've all helped make this campaign a success. We've raised awareness about musculoskeletal health and shared examples of how healthy workplaces lighten the load across the European Union. I don't need to remind you that we carried out this valuable campaign during a global pandemic, which challenged nearly every aspect of how we collaborate on and roll out this campaign. That makes the success of our Lighten the Load campaign even more remarkable. And I think all of the agency staff involved in that deserve a really big round of applause at this moment in time. They were fantastic. Our deep and lasting impact on workers' health and safety has been visible throughout the summit. One of my highlights was Professor Todoli's keynote speech this morning on making algorithms safe for workers, and how it encouraged a panel discussion for lots of opinion to be shared. I think it is important, though, to remember that not all algorithms have a negative impact, and it's something we will take with us into this next campaign. The 4th industrial revolution is where we must now turn our attention. Digitalization presents increased opportunities, as well as greater challenges and risks in terms of occupational safety and health. Digital technologies have come to be essential services in every sector of our economy and society, which is why I posed the question earlier on about our smartwatches. Society is progressing incredibly quickly in this, and we have to catch up. This is why I'm so pleased to introduce our next Healthy Workplaces campaign, Safe and Healthy Work in the Digital Age. Despite significantly changing our working lives, the effects of digitalisation on occupational safety and health are relatively uncharted. The digital age offers many potential benefits. Automation, which can allow machines to take over repetitive and unsafe tasks. Robotics, which can support and replace people operating in hazardous environments. Big data, which can enable effective OSHA monitoring systems. And remote working, which can offer employees increased autonomy and flexibility. And I'm a beneficiary of remote working. And my work-life balance has been reclaimed somewhat over the last 2.5 years. On the other hand, digital technologies can pose safety and health risks, particularly psychosocial risks, and we've heard a lot of that over the last 2 days, starting with the musculoskeletal issue and transforming into the digital potential. Indeed, in a recent EU-OSHA survey, the OSH Pulse, a significant proportion of workers report various risks related to digitalisation, including time pressure, job insecurity, and longer or irregular hours. Other aspects of digitalisation, such as monitoring employees, could make them feel less autonomous and under increased pressure to perform to certain standards. And in new forms of work, occupational safety and health regulations and responsibilities are unclear. But remember this, there are jobs we are doing today that were not envisaged 5 years ago. We cannot wait for regulation to catch up. This is why the Framework Directive was so encompassing when it first came out all those years ago. It empowered workers and employers to manage risk. The overarching message of our next Healthy Workplaces campaign is that digital work brings remarkable benefits, but only if designed, implemented, managed, and used with a human-centric approach. And we heard great examples of human-centric approach, thank you, over the last hour and a half. The pros and the cons, but the human-centric approach is key. From 2023 to 2025, we will raise awareness on how to use digital technologies safely and productively across all sectors. We will explore the associated challenges and risks and gather stakeholders to collaborate on a digital transformation of work that puts people first. This new campaign will have 5 priority areas: remote and hybrid work, smart digital systems, digital platform work, automation of tasks, and worker management through artificial intelligence. As always, we welcome participation from all stakeholders, in addition to our traditional network of partners. And we will reach out to the research and technical community, the software and industrial designers, and startups. Just like in promoting musculoskeletal health, we need all players around the table to make significant and lasting changes for workers in this digital age. We need your help to make this campaign a success. Safe and Healthy Work in the Digital Age officially launches next October, but you will have plenty of opportunities to get started before then. Our website goes live in April. There, you can already access some of the campaign materials, such as the campaign guide. We will also continue to publish reports and discussion papers on the topic of digitalisation and OSH. Thank you again for joining us in Bilbao and being an integral part of our Lighten the Load campaign. Musculoskeletal health has become much more visible across Europe due to your efforts. And we have seen countless innovative ideas to prevent and address the issues of MSDs. In addition to the companies and organisations working on the topic, I know many of us, myself included, have made personal changes in the way we work. I'm confident we will remember these lessons well beyond this campaign. I look forward to seeing you all again over the course of our next campaign. And as I said, we need your help to make work in the digital age safe and healthy. And now it is my great pleasure to hand over to William Coburn, EU-OSHA's Interim Executive Director, for his closing remarks. Thank you very much.
I opened that for you as well. Yeah.
Well, it's a real privilege to be able to wrap up these 2 days. But first of all, a great thanks to you, Michael, not only for the excellent wrap-up that you've just made, but also for being a fantastic chair of our management board. And with that, I will also take the opportunity to thank all of the members of our executive and the management boards, without whom the support throughout the period of this campaign, but also on the broader work program of the agency would be nothing. So thank you. Over the last 2 days, I don't know, they feel like they've gone by in a flash to me, but the first interventions that we had from the top political level really made an impression. We had intervention from the Commissioner, Nicolas Schmit, from Vice President of Spain and Minister for Jobs, Yolanda Díaz, the local government, Vice President Idoia Mendia, and of course, under the Czech presidency, the minister with her video address as well. And what struck me was not only their commitment and how they stressed the importance of the work of the agency and the work of this campaign that's been undertaken by all of you, but also the depth of their knowledge and their preparation. And I think they really set the scene and gave us a lot of food for thought. So yesterday we also went down to the practical level and we gave the Good Practice Awards to fantastic examples that came through from the national level, which the focal points were again crucial in managing for us. We also had the parallel sessions where we heard about preventing MSDs in practice, working with chronic disorders, and the connected risks with mental health. And this campaign is probably the one that has been most strategically planned for the agency. We had our 8 priority areas, we had 2 full years of campaigning, and we were able to build that campaign on a solid 4 years of research. And a lot of that came through in the panels, and it was fantastic to see that foundation really stimulating the practical outcomes and the presentations in the parallel sessions. Then yesterday in the evening, as you've mentioned, Michael, it was fantastic, really, to come together in the Torre Iberdrola and to have our networking event and to see such dynamic exchange and really so many relations reconnected. When I took the floor for a few moments, I did mention the investment in all senses of what it means for so many of us to gather here in Bilbao. And I think I could see firsthand a lot of networking going on there. But I should mention that we've also had a lot of side meetings. Already there's been a roadmap on carcinogens meeting, a meeting of the Enterprise Europe Network. We've got a focal point meeting planned. We've got executive board meeting planned. Tomorrow we've got G20 meeting planned. So really, I think we're getting the most out of the face-to-face participation here. This morning, it was a great pleasure again to give more awards. This time to the examples of the Europe Enterprise Network OSH Promotion Awards, together with my colleague Giacomo. And now, of course, we've had the panel discussion leading us into the next campaign. We had a somewhat dystopian vision presented to us as a starting point and a real catalyst for discussion, a real prompting of debate, which was what we were hoping for. Within the campaign itself on digitalization, we'll be stressing not only the preparedness, the identification of challenges and risks, but also, of course, the opportunities. We heard about, for example, the use of algorithms in call centers. I remember one of the first uses of algorithms that I heard of in call centers was identifying from the tension in the voice of the caller, particularly aggressive clients, and they were able to be diverted to more experienced call handlers, thereby avoiding pressure on the newer recruits. So there are obviously good examples that we will be bringing forward. So coming back to MSDs, I think the conclusions that we can draw is that it's still an absolute priority. It's still an issue that beyond the end of this campaign, we need to work incredibly strongly on. We've heard about how not only physical but also psychosocial risk factors such as excessive workloads contribute to the development or exacerbation of MSDs. And we have an important research program that started this year on the topic of psychosocial risks and mental health. The situation, of course, has been made worse by the pandemic and new challenges arising from working from home, working remotely, for example. Michael mentioned the OSHA Pulse survey that we carried out. We also asked questions in that survey related to general health. And there the survey confirmed that 30% of workers suffer from bone, joint or muscle problems or pain, 27% from stress, depression or anxiety, and 37% from overall fatigue. So we can see the challenge is absolutely still there. I'd like to come now to thank those who are responsible for making these 2 years, this campaign, a success. I'd like to thank the campaign partners, the media partners, the Enterprise Europe Network, social partners, and as I said before, the management board and the EU-OSHA staff for their involvement in the campaign. And I would invite again a round of applause for the EU-OSHA staff, particularly close to my heart. However, there's one group that I haven't mentioned, but I did mention yesterday in the presence of the ministers and the commissioners, and that's our network of focal points. I did say that they're unique to this agency. We're a small agency, and without that network of national authorities and the national tripartite networks, we would not be able to do the work we do and have the impact we have. Throughout the life of this campaign, I mentioned the research that preceded it. The focal points were instrumental in finding examples of good practice, presenting to us the situation from the national level. Later on in the campaign, raising awareness, carrying out awareness-raising tasks, events that have been carried out in the hundreds across Europe. And really, it is just through the work of the focal points that a campaign like this can have any hope of success when it's driven by a relatively small agency here in Bilbao. So a big thanks to all of you who are here today and any of those online. And I'd ask you to give another round of applause. So with that, I would just like to say that I really hope that you continue to work with us on not only musculoskeletal disorders, but on the topic of the next campaign, Safe and Healthy Work in the Digital Age. And with that, say farewell and have a good trip home, and hope to see you again soon. Thank you.
Well, that's it. I have one bit of good news. A phone was found. So whoever has lost their phone, it was found in room 0C. And if you're looking for it, it's outside at the registration desk, and you can pick it up there. It only remains for me to say thank you to all the colleagues, in particular the ones who worked very closely, to all the colleagues in the agency, because nearly everybody works on the campaign and on the summit. But in particular, those colleagues who put together, it took a lot of work to put together the summit and the press conference. Thank you to you all. I would also like to thank the technicians who are hiding in there behind the curtain. You can't see them, but they're really, really busy people. And I'd also like to ask you to give a warm round of applause also to the interpreters. The bad news, we won't know until you've left how many of the 10 missing headsets we will get back. However, I would like to announce that the amnesty will run until this evening. And there will be no repercussions if you sneakily give back one that you were planning on taking home with you. And from tomorrow, all hell will break loose and we will hunt you down. Thank you so much for our online viewers who joined us from really faraway places, of course, all over Europe, and from many far-flung places. We hope that you found this an enriching experience. And also, and finally, a very warm thank you to those of you who took the time and effort and trouble to travel to Bilbao, which is, as you all know, the most beautiful city in Spain. It only remains for me to wish you safe travels home, stay healthy and safe, adios, and see you soon. Bye-bye. Okay.